Hey guys, today on The Pregnancy Nurse, we're talking IVs. That's right, this bad boy up here. It's really important that we have access to your vascular system, but you guys are a lot afraid of needles. So let's talk about it. Hi, I'm Hillary. I am the pregnancy nurse and I am the curly head behind the website Pulling Curls. I have been a nurse since 1997 and I have over 20 years of labor and delivery experience. I'm here to simplify information from bump to bassinet so that you can have the confident, collaborative hospital birth that you desire. Today we're here to talk about IVs because I know a lot of you have a lot of fears surrounding IVs, so we're going to talk about how they get put in, what to expect, why you need one, why you might not need one, if there's an alternative, is there a wireless IV? So we're going to talk about all those different things, and I'm in fact at the end of the episode going to give you a whole run through about what putting an IV in is going to look like and what you should expect as you get your IV. So what are the benefits of an IV? Why are they the standard of care in the United States as far as women who come to the hospital to have a baby? We want access to your veins. That is what is most important to us about an IV, because at any point in time you could bleed a lot, and so it's really important to us to have access to your veins to give you medication, possibly blood and fluids if that were to happen. That is the reason why most women have big complications with pregnancy. But there's other reasons that you need to have an IV in as well. If you want an epidural, if you want IV pain medication, obviously you're going to need an IV. If you are having an induction, most often you will need an IV. Sometimes it doesn't have to be hooked up to fluid, and we'll talk about that a little bit more. Also, if you're having a C-section, you have to have an IV. It's major surgery, so that obviously makes sense. What are the cons of an IV? That's a good question too, because anytime we do a procedure in the hospital, there are cons to it. So when we put something in your skin, there is always a chance of infection, and that's just something that could happen. We try and mitigate that by using alcohol and a transparent dressing to make sure things are okay, but there is a chance of infection. There is a chance of you just feeling over-hospitalized during your stay. We don't want you to feel sick in the hospital. We want you to be a collaborative partner in your care, and when you're tied down with an IV where you can't move and all those kind of things, it just feels more hospital-y. And I get that. I want to support that. So there is a happy medium. This is called a saline lock. It is put in your arm, but it is not hooked up to an IV bag like that. So you can still move around. It is in your arm and it does have the IV placement, but you aren't chained down to a tubing. So that is a nice happy medium. And it can just hang out until after you have your baby, and then we pull it out just like a regular IV. It is a nice happy medium, but again, you cannot use it if you are having an epidural. Some forms of an induction you can't have. A lot of inductions will use a saline lock initially and then usually have to hook into the IV for Pitocin. You cannot use the saline lock just for a C-section. You can get IV meds through a saline lock, but a lot of times they're going to want to hook up fluids as well. So that's just something to be aware of. So what should you do if you don't want an IV? You don't even want a saline lock. You don't want any of that. Talk with your provider. It's really important that you guys get on the same page in advance, because if you've never talked with your provider and then you show up to labor and delivery and you tell your nurse that you don't want an IV, but your provider has ordered an IV, then it just starts a chain of events that is difficult. Whereas if the doctor's written she does not need an IV, we've already discussed it, the nurse will probably again go through the risks and the benefits, because she's going to be the one that's there with you if you were to have a bleeding issue. But then a lot of it's solved, because nurses' jobs are to carry out doctor's orders, and if they've ordered the IV, then we have the problem of you not wanting the IV. So something to talk with your doctor ahead of time. I have a free printable birth plan that I will put in the notes of this episode, where you can think about all the different things that you might want to talk with your provider about ahead of time. Okay, our good friend Lammy here has said that he would help us find out how we do an IV. So your nurse is initially going to come. She's going to put an elastic tourniquet on your arm. Again, we had to do Lammy size. And that is going to really just help your veins to pop up. So she's going to do that. She's going to feel a lot. This is very normal. Don't be concerned if your nurse is feeling here. She's feeling on your hand. She's checking the rest of your forearm. Feeling is good. Good nurses feel a lot because they want to see how that vein feels and if they think it will accept an IV catheter. Okay? So once she's chosen her vein, she's going to put on her gloves. She's going to put her gloves on because that really protects her. It's not really protecting you, just it's protecting her from any bloodborne pathogens. She, again, is probably going to feel the vein. Then she's going to take her, whatever she uses at their hospital to sterilize the site. It's usually not an IV wipe, but usually it's something fancier that comes with the IV kit. She is going to get out her IV. So this is an 18 gauge. That's usually the gauge that they're going to put in you. She's going to feel it again. with her sterile fingers. She should have wiped that off, but, and then she's going to go in. She's looking for a flash of blood in this area right here. Once she gets that, she's going to put the IV catheter further in, all the way up your arm into your vein. She's going to pull out the needle, so the needle is completely gone. That is just the plastic tubing. At this point, she's going to get some blood out of that, usually for your labs. And once the labs are done, FYI, a little blood may come out of your IV at this point in time. Totally normal, nothing to be concerned about. She is then going to plug in your IV. Now this is just the hep lock that we talked about before. If you need IV fluids, she is going to add the IV tubing to that as well. So little Lammy does not need a lot of hydration though, so we're not going to turn that on, but that's how an IV works. Remember, the needle is completely out. She's going to search for a place that will make it easy to push, easy to hold baby and breastfeed, but also one that she can get. So that's what the nurse is looking for. Let's take a second to look at the IV tubing. Okay, so let's talk a little bit about your IV bag. Now, they don't sell IV bags on Amazon. I think you have to have a prescription, but they do sell bachelorette party bags. So that's what this one looks like. It will be labeled with whatever fluid you're getting. This is lactated ringers because that's what most often you get, and it will not look blue. I just did that so you could see that there was actually fluid in it. So your IV tubing goes down to a drip chamber. Your nurse is gonna fill that up with the fluid. She's going to open her clamps, and then she's going to open this little roller ball guy and make sure that your IV runs in. If you can tell right now, it is running in really quickly. Your nurse is probably not going to allow that to happen for a real long time, maybe if you're dehydrated or if you're getting an epidural soon, but it's going in as we like it. Your nurse is going to slow that down, and if you can see right now, it's just dripping in. It's not running in. So it can go really fast, which is what we would want if you were losing fluid quickly, or it can just drip in. Usually your nurse is going to hook this up through an IV pump, and so that's what you're going to see this going through later on. And that is your IV bag. So, oh, one other thing, sometimes you'll see bubbles along this line, and that isn't anything to be concerned about. A lot of people get really concerned that the bubbles are going to go into their system and be a problem, but you'd have to have like a whole IV tubing full of air in order for it to be a problem. So just something to be aware of. Okay, so that's IV placement. One thing I forgot to mention is they are going to put a whole lot of tape on. They're going to put something that looks kind of like a saran wrap over it so that they can keep an eye on the site and make sure you aren't getting infection. And then there's a lot of tape so that you're still able to move. Also, one of the most important things is even when you have the IV in, you're still going to want to move that hand. A lot of people just keep it stiff straight and then it swells up and they don't know why, but a lot of our body uses our movement to help circulate the fluids in our body. So still use that hand. If it's uncomfortable, use the parts that aren't as uncomfortable. The nurse is going to look for something more along the forearm. We try to avoid the hand because it can be a little bit more painful, and we don't do the antecubital site because as you're pushing, that site kinks off, and then also as you're holding your baby and breastfeeding, it also kinks off. So that makes it hard for us to do the things that we need to do, which is run in fluids quickly if you're constantly kinking it off by moving your elbow. So we try and put it in the forearm, this area. Also, your nurse may try a few times, and that we're trying to get it in on the first try. We feel a lot of pressure to try and get it in on the first try. It may take multiple people to come in, and if you drink a lot of fluids before you come into the hospital, it can really help us get in the IV faster. So it's one of the reasons that I recommend drinking lots of water when you're in labor. Not only will it help prevent false labor, but it will also help your IV get in easier. So that's IVs. If you guys like this kind of information where you can learn about your hospital stay, please subscribe to my channel. We're new around the YouTubes. Like this video so that you can see more of information to get you prepared for your birth, and we'll see you next time.